with Corinne Furnari, clinical nutritionist and physician assistant, and my co-host, Carol Petersen, pharmacist. Every week, we present you with new and creative ways to help you make sense of health information and bring it home to you and your family. With years of clinical experience between us and research into traditional and cutting-edge technologies, we give you practical information to help you take charge of your health. Welcome back. We're here. I'm here with my co-host,
Carol Petersen.
I'm hearing an echo. Are you, Carol?
Yes.
Okay. Well,
maybe
it'll
it'll
maybe
start out in a minute.
someone can deal with that. Oh, it's just an earphones. Oh no. Back. Okay. So today the conversation about pain. And it came about by the fact that I was talking to a physical therapist who just came back from a conference, and he was talking about the fact that there is so much need for physical therapists without having enough people to service or deal with the need. And that was what the conference was all about, was that the overwhelming request for physical therapists. And we started talking about that, and I said, well, the population's getting older. And, and so what do physical therapists do? They help keep us agile, and they help us avoid pain. So we decided to create a program on pain busters and how the different modalities, from pills to herbs to proteins to peptides, and I have a brand new one that I didn't know of till I started doing this research, and now I'm really going to be looking into it. We're going to do that at the end. We're live, and we're live on YouTube. So we are also going to want to speak with you. That's very important to us. So let me give you the phone number. The phone number is 212-209-2877. 212-209-2877. You can call in and I will answer your questions or even just talk with you. And then the other way to get a hold of us is take charge of your radio on YouTube. And you can type the question and you can hear us responding to your question. So I look forward to you joining the show, and I look forward to speaking with Carol. Hi, Carol.
Well, I hope.
So where shall we begin?
Well,
we should start with
I wanted to start with Tylenol. I'm wondering if this is a problem at the station or Zoom. So we're having
Tylenol or the echo?
both help somebody fix it. Anyway, I want to start with Tylenol because Robert Kennedy Jr. just announced that we should not be using Tylenol with infants when they're getting vaccinations. That this is a problem that can cause autism in the end. So this is a problem. Tylenol is detoxified in the liver, but it uses up all of your glutathione, and so your body has no way to handle the assault of something else.
It's hard. It's hard to focus because of the echo. But
Yeah.
there's something else. Tylenol is unique. It doesn't really work in, like, if you break an ankle and if your ankle is swollen, it will not bring down the swelling. It does not work by blocking pain. It works in the area of the brain that senses pain. And when it does that, the end result is that you do not feel as much pain. So it doesn't have to do with blocking the pain. It relieves mild to moderate pain and fever by acting on the brain. It's safe, or can be safe, if used correctly, but avoiding certain times isn't such a horrible thing to do. And you have to understand why. Um, I'm sorry, the echo's confusing me. I hope you're not hearing it.
Yeah. Reggie, I wonder, one time the microphone was open at the station and caused this.
Guess what?
What? We're
It
fixed?
just disappeared.
Aha!
Aha! So now we can think. We can even
Oh my
talk.
God. Oh my God. Yeah.
I was
This is,
losing my thought because I kept on hearing myself echo so much. I
so
think there's
thank you, Reggie, or thank you,
being
Jeremy, whoever
thing,
fixed us. Thank you. And thank you,
with
audience,
the
for
4
sticking
o'clock
with us.
time, because this is really something. Okay, so Tylenol, and so everybody got very upset. Tylenol, the risk of Tylenol has not really been appropriately explained to the public.
Yeah.
You know, the number one cause of suicide is, or death with a nonsteroidal anti-inflammatory, has to do with acetaminophen, has to do with Tylenol. And that's because, as Carol was saying, it blocks the liver's ability and the brain's ability, but specifically the liver's ability to make or work with glutathione. And the end result is that the liver can't function, and so people literally die from
From
I'm
toxicity
back
from the
again.
liver is not working.
Exactly.
Yeah.
And the way that they prevent that or stop that when someone comes into the hospital is they do IV lipoic acid. And what does that do? That works within the liver and turns back on the glutathione ability to synthesize and take in and produce glutathione. It's a very powerful thing.
N-acetylcysteine has been used for that as N-acetylcysteine has been used to as source material to make more glutathione and has rescued people from Tylenol
Also,
overdose as well.
that's
So
that NAC converts to glutathione.
right,
So
right.
they're giving the body the precursor it needs to create glutathione. So go on, Carol. You must have
Well, so we have this issue. It's not a good idea to give a child Tylenol when a child is under exceptional stress from other toxic substances. So what are you supposed to do? So I wanted to know what happened to baby aspirin. So I checked, and well, they're saying, oh, acetaminophen for children. But I looked into Dr. Ray Peat, who I'm a fan of, and he recommends aspirin over other things. He said aspirin has some unique properties that can be very broadly anti-inflammatory and analgesic. And I remember having baby aspirin. Don't you remember a little kind of
always.
pink colored thing? And my mother
And
would crush it up in a spoon. and make me eat it. But I don't
Well,
I don't know why we left off not using aspirin. And I have a few suggestions from Dr. Pete. Did you want to
oh,
say something,
please.
Corinne? Oh, I
No,
have some suggestions.
go right,
So
go right ahead.
here he says here are some practical strategies, and this is for anybody using aspirin. Actually, one when you have problems with some of these analgesics, it's a stomach that can be a problem, and you can have bleeding actually even. And aspirin, if you overdose on aspirin, would be a big issue, either bleeding from the stomach or even brain bleeding. So he says aspirin should be dissolved in water before taking, and that lessens the direct irritation to the stomach lining. He said also best to be taken with food. The stomach can develop a tolerance to aspirin's effect over several days. So starting with a low dose and gradually increasing can help minimize side effects. He also reports that it breaks down into salicylic acid, which is protective to the stomach and intestines, distinguishing aspirin from the other non-steroidal drugs that tend to cause more stomach damage. He said aspirin irritation risk has been overstated in animal studies and used very high doses, not the usual human dosing. And so he's got quite a holistic point of view about using aspirin. He says you really shouldn't be using it all the time, would be another consideration. Just use it when you do need some pain relief.
Um, I think that
Oh,
that's
one
very
more.
good advice. Go.
K2. So if you don't want that blood thinning effect from aspirin, you can also take some extra K2 with it.
Sounds good. We also used to, when I was in training quite a few years ago, suggest baby aspirin for people for preventing um, cardiac events. And so men were not taking an aspirin, they were taking a baby aspirin
Mhm.
daily. Is it still available?
I think so. I think an
But
80
it just
milligram
got
low
out of
dose.
fashion. What?
I think it's out of fashion. I think you can get an 80 milligram aspirin rather than 5 grains, 325 milligrams.
Hmm.
So
Well, you know
it
what?
should be available.
Aspirin is one of the most studied nonsteroidal anti-inflammatories that ever existed. It's been around for so long, and it started as a herbal remedy. It began as an at one source of it anyway is an extract of wild yam, or no,
No,
I'm sorry,
willow
wild
bark.
lettuce and willow
Why
bark.
a willow
Both of
bark?
those have both of those have aspirin in them, and have been used forever. And so it's something to look back at and see if that works for you. But then there was another thing that they've been using and have created many problems with their opioids, uh, hydrocodone, and mixed with acetaminophen, like Vicodin or oxycodone. And the problem with that is, first of all, your body builds a resistance. First of all, it works. Then your body builds a resistance. Then you have to go up. It also blocks your own natural ability to deal with pain, but it also can be very addictive. So the use of it should be very short term, if that is used at all. And now I don't know, I think we're beginning to understand that and the dangers. They're also using antidepressants for pain, and Cymbalta and others, which can work, but they work in the brain rather than as acetaminophen does. They work in the brain rather than in the tissue. But these talks about all these painkillers beg the question. And the question is, why is there so much pain? Where is it coming from?
Oh,
And
but before you go there, you missed a
yes,
very big class of drugs called the nonsteroidal anti-inflammatory drugs, the NSAIDs. And this
oh,
includes,
yes,
I'll just go to very very popular
please.
one, ibuprofen. And ibuprofen and its similar products do help with pain. They do recommend the use of ibuprofen in infants over 6 months old. And it certainly has been used. I know there are liquid formulations for children. But ibuprofen still has quite a large amount of bleeding happening. So, emergency situations from bleeding from this class of drugs, it is hard on your gut. The trouble is, all this is silent. So, while your digestive tract is getting irritated and damaged, it's silent because of the anti inflammatory effect of these drugs. Jerry Lynn Pryor is actually doing a study. She likes these drugs. They're in the family of COX-1 and COX-2 inhibitors. And for menstrual cramps, for severe menstrual cramping, she has recommended ibuprofen as a solution. And I think she's recruiting for a study on this. However, my counter argument would be progesterone is a very effective COX-2 inhibitor in its own right. So here's where I would just go up on progesterone if you were using it for PMS. Cramping goes away very, very easily with progesterone.
Thank you, thank you. And there's another piece is that when you're having stomach irritation like that, you want to look at copper. In the old days, aspirin wasn't aspirin, it was called copper aspirinate. And that was in the turn of the centuries in the 20s and the 30s, because using the aspirin and using the copper together eliminated that inflammation that was being created by the aspirin, by the nonsteroidal anti-inflammatory, the aspirin, and protected the stomach wall lining. And there's something else to that that's very interesting, because there is a peptide that's called PBC 157, and that's derived from gastric juices. And it accelerates tissue repair, reduces inflammation, and it's used for musculoskeletal joint pain with benefits, healing injuries without opiate side effects. But what is blocked when we start taking these nonsteroidal anti-inflammatories, which is created and built in the stomach to protect the stomach wall lining? What's blocked is PBC 157. And so here we're blocking our own natural stomach protective. So,
I have a little experience with BPC 157. I've been having some issues with my knee, and I've been doing some injections, which we could mention this as something to help with pain. I just had a client today who told me about a misadventure with a cortisol shot, and so I
oh no.
said, you really should look into platelet rich plasma or platelet rich fibrin we were talking about the other day. These are really good alternatives to the cortisol shot, where people are seeking that out now for the underlying problem of inflammatory issues and pain in joints. So you basically you inject some of your own fluid from blood, and I've had this combined with that specific peptide BPC 157 in my knee, along with some ozone, and it certainly does give me some relief. Now I've had this done 3 times. It's not gone yet, but on your advice, you say just keep doing it until your knee has recovered. Really, modern medicine, outside of those cortisol shots, which actually further erode your joints, you have temporary pain relief, but your joint is further eroded. And in the end, the offering is that you get surgery and replace the whole joint, whether it's your knee, your hip, or whatever. This is pretty drastic, I think. So the best thing to do, if you can source this treatment, you're going to get a much better outcome. And I know, Corinne, I'd like you to comment because you use this in your practice.
I used it for years, and it's really wonderful. And I began using it after treating myself
Uh-huh.
because I my knee had gotten so bad I couldn't walk, and I was taking supplements like a river, but it wasn't working. But obviously I wasn't taking the right ones, because we're going to talk about a few that can be very beneficial. And I gave myself a shot of PRP with some ozone, and it was instant. I literally stood up and said, "How could this be?
Yeah.
It can't be that rapid." But PRP has a rapid onset and dissipates very rapidly. That's why you continue to have the treatments for a while until you heal. But whereas stem cells have a very slow onset, you won't feel anything with them. And then in 3 months, you'll notice, oh, maybe I'm a little better. And it builds slowly. I was just reading in this week, just reading a study on collagen, and
Mm-hmm.
how a very large study on collagen over a 9 month period, they were able to, and so it's not quick, it's not once in a while, it's consistent. And a consistency over 9 month period. And the end result is they could see the cartilage regrowth and reduction in pain in adults. Okay, and this was men and women. It wasn't one or the other. So, um, looking at collagen as a support nutrient could be very powerful to add to this protocol. And you won't only find it in a joint that might be bothering you, might end up with more flexibility in all of your joints and reduce pain for uh, for the entire body, not just one area.
So I'd like to jump into hormones, my favorite topic. You started talking about the opiates and how people develop resistance to it. And I believe it's kind of tied into testosterone. Testosterone, your major anabolic hormone, has a connection with pain. And when your testosterone is low, you feel pain more acutely. When you use an opioid, it further depletes your testosterone, so you go even lower. So your attempt to get some pain relief backfires a bit in that you need to go to ever increasing doses because you are decreasing your testosterone. Now, this is particularly alarming because testosterone is the major hormone directing all new protein being made in your body. And if you're expected to try and heal a joint, a bone, or anything, and at the same time you're using pain pills, which are diminishing your testosterone, you're shooting yourself in the foot for trying to get that pain resolved with your body taking over and getting you healed. Corinne, should we give out the phone number and have people phone in?
Yes, 212 219 07. Wait a minute, 212 209 2877. 212
209
209 2877. And also, take charge of your health radio, and you can type in a question, and we'll be glad to answer it. So, we were talking about hormones, but every time I'm looking, not but, every time I'm looking up hormones, something that comes up consistently is every time I'm looking up pain, what comes up consistently is marijuana. And there have been some very large scales and very reputable studies showing a reduction in pain with marijuana capsules and drops um, over a few week period, and they did double blind with nonsteroidal anti-inflammatories and uh, comparing it to marijuana or THC, and they found a significant difference in response. It was a trial in 2025, so it's recent, and with a cannabis extract, and there was a significant pain release. So it's very interesting because I was in Central America. I lived in Central America and worked in Central America for a while. And one day my daughter gets this whopping cold. She was a baby, and I really thought it was bronchitis. And a grandmother from right around the corner saw her and brought me, went to her garden, pulled out an herb, and brought it to me, and we boiled it up with honey and gave it to my daughter. She went sound asleep. She slept for a few hours and woke up without a cough. It was really significantly dramatic. So I've always thought of the appropriate use of marijuana as therapeutic. And in this study and in this case, that's very true. So there is also
Go.
CBD and CBD. Do you want to
No,
add
no,
something,
no.
Carol?
Go ahead. Finish that. I thought you were finished with marijuana. Wanted to jump back to more hormones, but
Oh,
finish your
okay.
thought.
Oh, well, I can go to hormones also, but CBD is a cannabinoid, which is uh, on the spectrum of marijuana without the THC. And CBD is moderating the antagonizing receptors to reduce inflammation. So CBD not only reduces pain, it reduces inflammation and interacts with serotonin receptors in the brain. So you feel calmer. So it's working on pain from the brain and from the neurons, but it also is working to reduce inflammation. So it's a double thing. Now, CBD is available over the counter, but the only problem is you don't know which ones are good or not, and you really do want to know. You want a good one if you're going to spend the money, or you say, oh, it doesn't work, and it really does, but it just wasn't a good sample. Carol, you wanted to
Yeah,
talk about hormones?
that's my confusion with all those products. It's hard to tell if you got a
Exactly.
reliable manufacturer. It really is. So I want to jump back to hormones because where there's pain, there's inflammation, and all these hormones. Uh, Starting with cholesterol, I'll call cholesterol a hormone in this case. So cholesterol, and then your body makes pregnenolone, and then progesterone, and then cortisol. All the cortisol metabolites. You have this whole string of hormones that are all anti-inflammatory. And I've heard many times when speaking with clients, I've been giving them progesterone first, as I like to do, and unexpected things just disappear. I just heard today from somebody prior to using progesterone, she had a constant hip pain that bothered her in the night, and she said all of a sudden it's disappeared. So you've been able to relieve that kind of inflammation. DHEA too, like testosterone, very anabolic and helping your body heal. This is an important part of getting rid of pain. There's an injury or inflammation your body needs to heal. And then there is vitamin D. There's a particular pain in your joints or bones that only vitamin D can satisfy. Corinne?
Definitely. That is important. The pain in the bone pain that not many people, but some people really experience. When they experience, it's quite serious. But guess what? We've got two callers.
Yay.
Hi. Hi, you're live. Your name, please?
James,
Oh, hi,
Oh, hello,
James.
James.
how you doing?
I've got something for you, and there's no book about it. Go on. How can we
Well,
help you?
two things I wanted to ask you. One is that you mentioned a book last week about uh, melatonin and the author. What was the book and the author?
Oh,
I,
yeah. It's on melatonin, and the title is in there. And I'm spacing on the name. The guy who was a professor at the University of San Antonio.
well,
Um,
that's where Ryder,
that's him. Yeah, Russell Ryder.
Russell Ryder lives and works,
Reiter on melatonin.
R
and he's
I
been
E
working.
T E R.
Yeah, he got an assignment when he was a graduate student to
What's
work
his
and
first name?
study about melatonin.
Russell. Russell.
And he said, "Oh my goodness, what a boring thing to do." And he started studying melatonin, and he's been studying. He's now in his 80s. He's been studying and publishing on melatonin since that first assignment. That became his life's work. It was kind of interesting to hear that. So, can we help you in any other way?
Yeah. Was the did you ever do a show on carpal tunnel syndrome? And if not, you intend to do one?
Well, we
No.
didn't intend to, but yes, we probably could, because that's an important thing, because it's very serious when people have it. They really can't function, they can't use their hands well and their digits. And in many cases, actually, the cases that I've seen, we've been able to turn it around. But not, it's not with everyone, but it's something that working with nutrients and oils and rubs and acupuncture can be very powerful in dealing with it. It's a wonderful thing.
B6 and B12 can be a miracle for carpal tunnel. So check that out.
Okay.
Okay, so thank you.
Thanks.
And keep on listening, because there's a little more that you will find quite interesting on this program. So,
We will.
hi, you're live. Your name, please.
Yes.
Hello?
Hi, my name
Yes,
is
you.
Robert.
Hi,
Hi,
Robert.
Robert.
Yes,
How can we help you?
it's fascinating. Yeah, it's fascinating that you're talking about inflammation and how inflammation is such a leading participant in so many problems with, as we get older. And I'm not a doctor. I'm not, you know, I just talking from experience, but
A
inflammation leads to so
consumer.
many problems.
Yes,
Yes, yes,
definitely.
yes.
And it
And
seems to.
I I personally I personally deal with, I'm in a high stressful environment and a high uh, labored environment, and sometimes I deal with pain management through taking self medication as ibuprofen or something like that. And I noticed that that's not an answer to pain management. Is there
No.
an alternative?
It's not an answer to long term. Acute, if you hurt yourself, you fall, you hurt yourself, It's not a bad answer, but people are chronically on these medicines, which are creating such a dysregulation intestinally and in their body. That's where the problem
Yeah.
comes in. Not
And
not
I
the
also
fact that you
noticed,
took it because you hit yourself with a hammer on your finger and it's all swollen and you need 2 days of an ibuprofen. That's not a problem.
I
So
found a book, and it was written by a Dr. Samuel West. I think it's like Seven Golden Secrets plus one or something similar. And
nice
he
title.
he describes himself as a lymphologist. So he says when you have a painful area, you have inflammatory proteins there. Those inflammatory proteins went there to help you get healing going. But when they persist, they get stuck there. Your lymph system is supposed to let them
Drain
work
them.
and carry it away. And when that doesn't happen, you get continuous inflammation. And so the therapy, although he likes things like those rebounders, and you can do body brushing, but the simple thing was just to find the sore spot, press on it extremely hard, and the pain kind of widens, and then you just brush your skin. Now, I used that on a breast cancer patient who had lesions all over his shoulders. And I did that for her for about 20 minutes or so. She got enormous relief of pain. I fell and I sprained my ankle and I couldn't even walk to the bathroom with it. It was so painful. I spent the whole day in bed, and I repeated doing exactly that, hitting those painful points hard, and then stroking my skin. And by the next day, I could walk. I was mostly recovered. This is astonishing for a sprain. Usually you have weeks of recovery. So if you can isolate where a pain is and just do this pressure on it, so you're breaking up those proteins, and then stroke the skin. It's really kind of lovely to get those lymphatic system moving along and taking care of that inflammation.
Well, that
can
since
I ask you a question?
Yep.
very
Can I ask you a
yes.
question? One more question. Uh, just as far as pain management, and I understand you say ibuprofen is dangerous, but does it or doesn't it increases the levels of creatine in the body?
Oh, that's a good
Create
question.
And
I
is
don't
that
know.
helpful? Is that
Creatine, yes,
beneficial?
is a basic building block protein. Your body needs it for structure and function. So, an increase of creatine is nice. But you're saying that, like ibuprofen, does do that, or
I'm
vice
asking.
versa? Should you use some creatine?
No, 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 no. Not about using creatine, but uh, number amounts of ibuprofen and taking that in long periods of time does increase the levels of creatine naturally in the body.
Yeah, I'd never heard that, so it's news to me.
no, I'm not.
Thank
I'm
you.
not aware of that either.
That's a pearl. We'll have to do a deep dive into that.
Uh huh. But there's some very effective herbs. So one of them is curcumin or turmeric, and that's a very effective herb as an anti-inflammatory. It brings down inflammation, it helps circulation, and it's an immune modulator. Very powerful and
Is that
very effective. And then there is, go on.
is there a, a brand that you recommend or
No, well,
procurement?
no, we really can't. This we can't talk about that here. We don't. We
Okay,
don't
all right.
recommend brands over the
Understand.
radio. Okay? Thank
Understand.
you.
All right.
So
Thank you. Thank
curcumin is
you.
very
Thank you
powerful,
so much.
and when you put it together with ginger, which is also a powerful anti-inflammatory, brings down temperatures. It's very good for digestion. And then boswellia or frankincense. You have a, a very powerful painkiller, 3 pieces of a painkiller that can work wonders for people. Curcumin doesn't work rapidly, it works slowly. It builds up. Ginger works more rapidly and it's not as strong. And boswellia has a little bit of both. It can work quite rapidly, but also it's known uh, to work long term. So that's a terrific formula.
So
Carol?
you introduced essential oils, but there's more in like menthol and peppermint can relieve pain, and and I'm thinking of what a friend of mine told me. She said, "Put some Vicks Vapor Rub on your knee. It'll really help." I didn't take the time to look in there, but it does have some of these essential oils to relieve
Uh
pain.
huh. We have 2 callers.
Okay, we better get to
So, hello. Your name, please?
Daryl McPherson, Bronx, New York.
Hi. How can we help you?
I wish I was, and at this point, looking at my body's in full rebellion, so it may be challenging. However, with regard to, it's like the last year in which you all have been talking about hormones, and it's like a totally different world in treating challenges people have in their bodies as compared to what you get from what the insurance companies are willing to pay for.
I know.
Do you all have any ideas as
It's
to
heartbreaking.
what
It's
brings
heartbreaking that we have a 2-tier medical system that
it
that
worse
people
than
that can
that?
afford it can get certain care, and other people, well, 3-tiered medical system. One,
Yeah,
people that can afford it can get anything they want or need or desire or want to experiment with. People who have a good insurance program can get many things. They're limited to to much, but they still have can, depending on their doctor, have good quality care. And then people who are limited with different plans or with no have a very low tier available to them. And it breaks my heart. I was talking to a practitioner from California today, and she said she's holistic, been holistic for 30 years. She said, this is a big pain in my foot, is that we 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 take insurance. It's just really hard. It's really difficult to do all the work and blah, 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 blah. She said, but you know what? It breaks up that multiple tier of medical care that we can give out to people. She said, so it's worth it. She said, I hate not being able to treat people because they can't afford it. So it's difficult. It's very difficult and particularly for the practitioners. It's very difficult. But I'm sorry that that's what's happening in your case. So,
so what I'm calling
anything
for,
else?
well, it's along the same lines. Um, do you know of any movements to get people who have capital to
No, I do not. I'm
finance
sorry.
people? Okay,
Sorry.
so then the last thing would be how, if you're locked into an iatrogenic system, how do you best take advantage of the information that you all are sharing? Because the results are totally different.
Lots of, yeah, can be. First of all, you need a little guidance because, just like I said, curcumin is brilliant. And the studies show it's brilliant and it's a wonderful anti-inflammatory. But when you open up a book and you see 20 different herbs, all anti-inflammatories, what are you going to do? You're overwhelmed. You don't know what to do. You start taking curcumin. Oh, it's been 2 weeks. Haven't gotten relief, so you stop taking curcumin. You need some guidance there. You need some help somewhere to have people guide and give you the confidence to move forward, because curcumin isn't just blocking; it's healing. It's an attempt to heal. And so when you're dealing with holistic medicine, it's not like I take a pill and everything is gone. It isn't. It takes work. It takes working with the practitioner. It takes working with your supplements. And sometimes I tell people I'm working with, well, let's see. Heard very good things about this. I've had very good things about this. If it helps us 10%, we're in good, much better position than we are now. And let's see if we can add something else on that'll support this other herb. So that's what we're dealing with, and I do apologize, but I have no way to deal with that. We have another listener, and there's something else I want to talk about really quickly. So let me go to the other listener. Good luck. Please have the confidence to do some research, do some study, and move yourself forward in a healthy way. Hello? You're live?
Hello?
Hello?
Yes, can you hear me?
Yes.
Yes, please. How can
I
we
was
help
calling,
you? Your name, please?
Brown from Manhattan.
Hi,
Hi, Brown.
Brown from Manhattan. How can we
Hi.
help you?
Okay, good show. I went to the doctor, like you said, with the knee. I have a knee issue going on, and they said I should maybe get an operation, but I've been holding off for a few years. And can you just say again what you said, other alternatives to do? I'm not sure if I want to
Well,
do the knee
well,
thing
what
yet.
happens is knees are being used all day, every day. And so are hips, and so are arms. So by holding off, the damage is increasing with every step you take. And so it's been a few years. We don't know what situation you are in. When you start out early on alternative therapies, the the change can be transformational. So that what I would do, or would be, if I'm getting knee pain, I get a diagnosis. I'd get an X-ray or MRI as needed, and then I would look at that and start you on a therapy. First of all, to bring down the inflammation, but second of all, a therapy to help you build up your cartilage if it's not too progressed. I have someone that was telling me that their knee has cysts and it's starting to crack, and the head, right, the head of the
Kneecap?
of the kneecap right in there, and that, yes, you could use PRP, but it depends on how fast you need help. If it's
Right, but
interfering with your
is there
ability to walk and
alternative
move.
operation? Is there an
Yeah.
What?
alternative to the operation?
Yeah, this is one of it, PRP, platelet-rich plasma, or there's also platelet-rich fibrin. So,
Well, they're equivalent in
and
terms of
and
quality.
then there's stem cell treatments as well. These are
And,
alternatives to.
and it's not one treatment. One treatment will not do it.
Yeah.
There has to be a continuity of treatment to be
Okay, can
able.
I
You'll
contact your
you'll
office
get some
and get
relief.
further information?
Oh, absolutely. Either leave a message for us on the YouTube live, or we're on Facebook.
On the Facebook,
Take
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 charge of
charge
your
of
health.
your health with Corinne and
Radio
Carol.
with Corinne and Carol.
Yeah, PMS
Take charge of your health.
with Corinne and Carol.
I think we have
What's
one
the
more
last name?
listener. I'm sorry.
Spell your name.
Um, Corinne and Carol, Corinne and Carol. Okay? Thank you
Yep.
for your call.
CAL.
Hi. I think we have someone else on the line.
No,
Is
we
that
don't.
No.
no? Okay. Well, then I want to talk about something that I discovered this week that is a totally different understanding of pain, where it's coming from, why it's increasing, and a new way. This is all new, but it's still of dealing with this, and it's a peptide. It's called Klotho, Klotho, and it's a it's a deficiency of Klotho, which Klotho starts lowering as you're aging. And as it lowers more, oh, the pain. I've got pain in my shoulder. I got pain in my hand. I'm getting older. Oh, my back. Oh, blah, blah, blah. All the things that we hear all the time as people are aging. Well, they have been able to directly link that with the peptide, the amino acid Klotho, which I had not been aware of before. I know I'm talking, so what they're finding out that Klotho is not an anti-inflammatory, not at all. Um, what it is, Klotho is an anti-aging protein. And what they're finding is that much of the pain that we experience has to do with an aging process. It has anti-inflammatory action. It has anti-fibrotic properties. It has a regulation of mineral metabolism, which we talk about every week, and it's got an endocrine receptor component. Okay, so in other words, you're able to absorb or uptake your own natural hormones. Let me say one other thing and then we're going to have to end. Really important. How do we raise Klotho? Carol, do you know?
No, I know somebody who injects it in
Yeah,
Florida.
exactly. Well, let me
How do
tell
you
you.
raise it?
Last week I wouldn't have known either. So the exercise.
Interesting.
Exercise. They show direct correlation between exercise and Klotho and an increase in Klotho. Very exciting. So what are we doing? We're taking charge, we're taking care, we're taking charge of our own health. It comes back to us. It comes back to our emotion. Some of the pain we experience isn't necessary, and it just isn't necessary, and we can avoid it. So,
I love
Carol,
that.
thank you so
Pain's
much.
not necessary. We need to
Thank you
change
so
our
much.
attitude.
Yes.
So
What's your
I would like to
website,
give
Carol?
out my website, the Wellness by Design Project.com, and I have a YouTube channel with the same name and a Facebook page with the same name. So you can find me all
Oh
over.
man, you're really cool, Carol.
Yeah.
You're right out there.
And
And
then
with fabulous information. You should really
Yes.
go to it. Go on, Carol.
No, now your turn.
My turn is Corinne Health is my website. I have multiple articles, and I just did a new article on the calf muscle, the gastrocnemius, and how it changes our insulin levels. Whoa, it reduces our blood sugar by up to 50% if done correctly. Did you know that? Eating the same foods. It's really powerful. So go on the website, look at the articles. There's lots to learn, and oh, and then take charge of your health radio. This is recorded, and we will be back next week. Next week is Thanksgiving. I don't know. It might be a replay, an encore, the best of the best. We always pull out the best of the best. So thank you for staying with us, keeping up with us. And Carol, I always love being with you. Every time we're together, I learn.
Yes, even off the radio, we learn
Even
from each other. So thank you so much, and thank you to our audience and callers. Thank you, Reggie. Thank you, Jeremy. This is a team effort to bring this to you. So thanks to everybody.
Thank you. Bye-bye. We'll
Bye.
maybe next week.